So, welcome everybody to The Big Idea. I am your host, Dr. Jeffrey Hanna at Atlas Health out here in North Lakes. And what do we do in these particular videos? What we do is we like to look at usually some complicated bits of research, but then trying to extract the big ideas, explain it in plain English for two groups of people. Number one, healthcare practitioners who probably should know this information as well, but more importantly, people. That is, people who are experiencing these different kinds of issues, syndromes, challenges, problems, so that they have a better understanding what's going on in their body, but most importantly, what they can do to help out and get the right kind of help that they need so that they can improve their overall quality of life. So what are we looking at for you today here? We have advanced magnetic resonance imaging, MRI, of chronic whiplash patients, a clinical practice-based feasibility study. Brand new 2022, fascinating paper. And in some ways, this paper is really not going to be widely promoted. You're not going to find this in too terribly many places because, as you will see, some of the conclusions that the researchers make aren't actually that useful, shall we say. And it's not to say it isn't useful, but in terms of it's not endearing. There's no smoking gun. There's no saying, aha, yes, now we can prove such and such. It actually kind of goes the exact opposite. But nevertheless, in this paper, they touch on a lot of really important topics. So for people who are experiencing whiplash syndromes, nerve-related symptoms, any number of varieties here, I want to go through this one with you here today because there's a lot of really good and valuable information. Per the usual, what we do is if you think, okay, this sounds like it's going to be interesting, we're going to invite you right off the bat to please click the like and subscribe button down at the very bottom there because, yes, it helps the channel out, but most importantly, the way it works with the algorithms is by you clicking like or subscribe, it makes it so that this video is going to be available for other people who may need to find it down the track. So you're helping them out just with one simple little click of the mouse button there. So anyway, and per the usual, here we go. Whiplash injury is common following road traffic crashes, affecting millions worldwide, with up to 50% of the injured developing chronic symptoms. This study investigated the feasibility of MRI techniques using quantitative diffusion, weighted imaging, and measurements of cerebrospinal fluid flow as a novel, non-invasive biomarker in a population of healthy volunteers and chronic whiplash patients recruited from a chiropractic clinic for the purpose of improving our understanding of whiplash injury. No statistically significant differences were found between the groups on MRI. The study did not show that MRI-based measures of morphology, spinal cord and nerve root diffusion, or cerebrospinal fluid are sensitive biomarkers to distinguish between chronic whiplash injury between people who have had that and healthy controls. And that's somewhat disappointing. In brief, what are they saying? They're saying that what they did was they took MRI and they wanted to compare people who had suffered relatively recent whiplash injuries versus a healthy control population, and they wanted to see were there significant changes in the fluid around the spinal cord in this particular case that could be used like a fingerprint or a biomarker is the term that says, aha, this is what the cause of these associated symptoms would be. And in brief, what they found was no, there was no difference in either the relative appearance of the cord or the fluid flowing around it or any of the other parameters that they were looking at that you could use to definitively say, yes, this person has had and is experiencing the symptoms of whiplash versus a person who hasn't. So in and of itself, you could be saying, oh, geez, well, we can't really use that, and what it certainly, or at least to a certain degree, what it does is it goes contradictory to other very valuable bits of information and hypotheses that are supported that are showing that certain groups of people who experience, these disrupted flow of their cerebrospinal fluid, that by getting that corrected, they're able to resolve these kinds of symptoms that are associated with whiplash injuries. And what this paper is saying is it's not quite that linear. But that's the beauty and the value of this particular paper here, both for its strengths and for its weaknesses. It's going to be talking about and showing that, especially for people who have had different kinds of injuries or experience these kinds of symptoms, and they have tests like MRI or cerebrospinal fluid flow or CT scans or any number of different tests, but unfortunately, the tests all, quote, come back as being normal and not having a clear way to distinguish their normal versus what they are actually feeling. This paper is basically going to say there's more to it than just that. And therefore, if you're hanging your hat on any of these particular tests, there still might be things that need to be explored, but also other solutions available to you. So let's have a little bit more of a deeper look at this one here now. So interestingly, and firstly, chronic whiplash patients often complain of neck pain, headaches, and pain of the cervical thoracic region, basically that bump at the very base of your neck. And oh yes, it is supposed to be sticking out a little bit more than the other vertebra in that area. What it's not supposed to do is it's not supposed to be sticking out to kingdom come, because that's going to be associated with other kinds of problems. But if you put your fingers on the back there and say, whoa, that one's sticking out a little bit, in and of itself, that doesn't mean that there is necessarily a problem. Nevertheless, pain in this area of the body. In addition, the majority of these patients suffer from varying degrees of non-painful neurological symptoms. For example, paresthesia, which means tingling in the hands and the fingers usually in this case, but it can be other parts of the body, including the face and the legs, dizziness, fatigue, memory deficit, and other cognitive symptoms, what sometimes is called brain fog, where just you recall things are not quite as sharp. It's like everything is a little bit foggier. Although different types of injuries in chronic whiplash patients have been identified and debated, including, for example, injuries to the cervical facet joints, so the joints that are involved with moving between the individual vertebrae and the neck, ligament instability in the craniocervical region, so the ligaments are what hold and strap bones together so that they don't just fall apart, saying that you can be having instability issues where it's not broken, it's not quite dislocated, but it's moving way, way, way too much than it should be. Let's see, where was the other one? Cervical spinal muscle fat infiltration. The old gym expression, you lose it, or you don't use it, you lose it. Muscle starts to turn into fat and it starts to weaken. And as a result of that, things, again, they can become a little bit more unstable as a result of an injury. And tonsillar ectopia, what that is where you have basically the brain starts to descend into the upper part of the spinal canal, puts more pressure in this area. The hypothesis on how this is related to whiplash: visualize, if you would, a balloon with a piece of string attached to it, your brain, your spinal cord. So if your neck snaps like this, there can be the attachments of that cord lower down that essentially pulls on it like this and causes that brainstem to herniate down into that upper part of the neck. So they're saying that there's a lot of different hypotheses, but currently there is currently no evidence to support an association between identifiable structural or somatic injuries and chronic symptoms following whiplash injury. In other words, there's not a one-for-one ratio with any of these things. It is not like, yes, we can prove that this person has a facet injury, therefore they have had whiplash, therefore they have these kinds of issues. Or, yes, we have these people who have ligament instability and they all experience whiplash, but then these people who don't have instability, they don't. What they're saying is that there is no one-to-one kind of relationship. And this is really going to illustrate the first point that they just sort of touch on in this paper, but really the important thing that's important for people who experience these things, especially if you have been to different doctors, different specialists, different allied health practitioners, and if you are still looking for one-to-one relationships, they don't always exist, simply put, and it's because we're dealing with biology. A can cause B, but guess what? A can also cause C, or D, or E, or F. And any one of those, B, C, D, E, F, guess what? They don't always have to be caused by A. You can have B caused by Z, or Y, or X, or W, and so forth. And there are other times where you can have these different things where it's a combination. So let's say you've got condition C. Well, guess what? C, in and of itself, there may not be one thing that causes it. But if you have a combination of two different things, that can be what ultimately is going to produce the issue. But here's the caveat. It's not always the same combination in different people. So you have condition C. For some people, it may be caused by a combination of A plus Z. Other people, A plus M. Other people, N plus P plus Q. You get the idea. And this is, again, one of the very frustrating things, especially you've been on the internet, you've been looking for answers for different kinds of things that you are experiencing, and you're looking for, oh, if I could just go to this one person and it would solve it. And you've seen people on the internet, they shared their story, they said, yes, I went to somebody who did such and such a treatment, and you figure, okay, great, I need to go see that person myself. You go, but you don't get the outcome. It's because it's possible that you can have the same end product, but the cause in your particular case may not be the same. Thus, the treatment is not appropriate. So what they're basically saying right here in terms of whiplash, and very important for people who have had neck and neck-related injuries or experiencing these kinds of symptoms, there can be more than one thing going on. And so by appreciating that, it means, and very important, that you can't put all of your weight and all your faith into just one test. And it means that you need to consider things from a more holistic perspective if and where you're going to be finding an ultimate solution for these things. In addition, it means that you're probably going to not need just one practitioner to help you out. You're probably going to need a team. But you're going to need and want a team of the right people. And by that, it means people who you resonate with and are able to provide the solution that you may actually need. So going back to this particular paper here, we're going to now go on to the second thing of interesting note. Whiplash patients' cases were defined according to the preceding trauma, the consequent persistent clinical symptoms in the clinical examination. The cases had been involved in a motor vehicle collision and suffered from ongoing, that is, chronic symptoms since onset for a minimum of 6 months, including at least daily neck pain and stiffness. In other words, these weren't people who had only just been in a car accident. They'd been dealing with issues for a little bit of a while here. And these were the ones that they're saying, okay, this is our whiplash group of people. Now, this is an important little aside, is I see a lot of people all the time who experience a great many of these symptoms. Neck pain, headaches, migraines, dizziness, vertigo, brain fog, fibromyalgia, the list keeps going on and on. And I ask them, and I say, because I can tell when I look at their scans, okay, you've been in some kind of a whiplash injury. Whiplash is not necessarily a car accident. It's anything where your head goes snapped forwards, backwards, or side to side, or any combinations of things. Heavy metal concerts, roller coasters, sports injuries, and that includes quote-unquote non-contact sports like swimming. How does swimming cause whiplash? Anytime you might smack your head into the side of the pool, the bottom of the pool, or get dumped off a wave and hit your hand on a sandbar or on a surfing board, any number of different things like that. Point being is whiplash is not a car accident. It's anything where the head gets snapped back and forth. And very difficult to injure your head without also injuring your neck at the exact same time. There's no distinction symptomatically between concussion or whiplash. Nevertheless, in this particular paper, they said, okay, in order to control a few variables, we're saying that the cause of these persons' whiplash is a car accident that happened at least 6 months ago. Cases were excluded when previous serious head neck injury, cervical spine, fracture dislocations, neurological symptoms to the extremities, spinal cord and or neurological disease, claustrophobia, and competing general illnesses were documented. Now this one I think is a little bit interesting. What they're trying to do as much as possible is they're trying to say that these people were not having problems prior to their car accident. So they had never had a serious head neck injury. Well, I got a real problem with that. This is where I've got to disagree with the authors of this study. It has to do with the definition of serious. Cervical spine fracture dislocation, neurological symptoms. Why? Because neurological symptoms to the extremities, they typically don't appear overnight. Some people say, oh, you slipped a disc, you sneezed or you bent your neck the wrong way or you had an injury and now all of a sudden you have this horrific neck pain with symptoms down to your fingers. That usually requires a very severe injury to happen all at once. For most people, that's something that accumulates over about 20 years following an injury. So they're trying to rule these different things out. Now, here's my issue, is where they say serious head neck injury. Serious, certainly, in terms of medical emergency. Fracture, dislocation, severe laceration, something that could potentially kill you or cripple you unless you are getting it attended to right away. But what they don't, and it's really difficult to exclude this, they don't include subclinical injuries. These are the kinds of things that happen to people all the time. Trips, falls, spills, knocks to the head, minor car accidents, quote unquote, where they don't break, they don't dislocate anything, but nevertheless they do cause a structural shift of some kind that sets the stage for future injury down the track. In other words, there is a problem, and this is the issue, is just because the paramedic or the emergency room physician might say, nope, nope, you're okay, that doesn't mean that everything actually is okay, because you can still have a much smaller issue, but then given a long enough period of time, like compound interest, 10 years, 20 years, 30 years, unpaid, it starts to accumulate, and that's how you start to develop these kinds of issues. So just because, again, somebody might say, okay, no, 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 you didn't have any serious injury, let's qualify that a little bit more, because you've got different kinds of injuries, and I do advocate this anytime a person has something that they thought that they're okay with. Yes, get it clear from the emergency room and the paramedics first, then go consult with your chiropractor. Go consult with your physiotherapist to make sure that you don't have a micro injury that is going to add up and cause bigger problems down the track, because it's much easier to catch it at that point than it is to wait until it's much more difficult to address. And this goes then to the very next point, the control subjects. The control subjects that were used in this particular study should be in good health with no current neck pain or neck pain episodes within the past 12 months that required treatment. This is the issue that I have. And they did talk about this later down in the article. They're making a presumption here that I've spoken of many, many a times that simply is not true. Just because a person does not experience pain does not mean that there is a problem. And it's because in your neck, you've got three kinds of nerve receptors: pain receptors, pressure receptors, which detect movement, and proprioceptors that detect muscle tension and are involved with balance and joint position sense. Only one of those is actually involved with pain. Moreover, they said no current pain where they needed to go for treatment. How many people, oh yeah, no, I'm okay, there's nothing wrong with me. Oh yeah, it's just a little bit stiff and sore. There's a hallmark that there actually is something, again, going on beneath the surface, but they're not assigning meaning to it that it is actually important. Why does all of this matter? It matters because when we're looking at these two groups, the whiplash people and then people that are, quote, normal, the people who are, quote, normal may not actually be 100% normal, maybe from a medical side of the equation in terms of fracture dislocation, but not necessarily as well, healthy, and true normal as they could possibly be. In other words, these guys might still have some things going on beneath the surface that are not actually being addressed. And as a consequence, it could be that these two population groups are not quite as dissimilar as they may seem just looking on the surface. Now, I do think that the researchers here, they went to the effort to try to standardize things as much as possible, and that is the nature of science. You're always going to be having your critics. I'm not coming at it from that perspective. I think in this regard, they've done a good job, and again, they address these things on their own a little bit later in this particular study here. Nevertheless, this is how science needs to be done, where we look at, okay, these are the strengths, these are the weaknesses. How then would we be able to do things better in the future? So what do? They do a series of tests where they're looking at changes in physical movement. They're looking at changes in the shape and the diameter of the spinal cord itself. They're looking for the term that they'll use a little bit later on. It's called modic 1, modic 2, modic 3. In brief, it has to do with, do you see evidence of too much fat, too much fluid, that is acute swelling, or a combination of both with subacute chronic kinds of injuries? as a way of telling the difference between new versus, say, old kinds of neurological traumas. They're also then looking in terms of, okay, is the fluid around the brain itself actually circulating the way that it should be? And this, is very, very interesting and important point. I'll kind of jump ahead a little bit here just to point the guy's name out here. Interesting, the study by Freeman et al. Who is Freeman et al.? These are a series of researchers who have been well documenting that among people who experience whiplash-related injuries, there is a much higher incidence, much higher incidence of disruptions of cerebrospinal fluid flow. And that disrupted flow is associated with any number of different neurological symptoms that these people are experiencing. The Chiari malformations, it's called myalgic encephalomyelitis, aka a fibromyalgia, similar to a chronic fatigue syndrome. In other words, swelling on the brain. It's like the brain is inflamed, producing full body fatigue, full body soreness, and not just superficial, very, very deep, no energy. It's associated with facial pain syndromes. It's also associated with certain kinds of neurodegenerative disorders. And what they're finding is that when you have pre and post outcome measures where you take an MRI and you see this disrupted CSF flow pre-treatment, whatever it is, and then you see it post-treatment, and if you see a change in that fluid flow, you see the resolution of so many of these different kinds of symptoms. So it's kind of a big deal if and when you see that. Now, what the researchers here are looking at, and they're basically trying to answer the question, okay, do all people, or is there a specific greater prevalence of people who have this altered CSF flow in people who have experienced these whiplash kinds of injuries? That's the reason why they're looking at this, because it means that if or when a person is experiencing, say, a chronic whiplash, they're talking about, this in terms of 6 months. But there's a great many people who deal with these kinds of things for years, if not decades, not able to find answers. And it may not be until much, much later when they have one of these CSF kind of flow studies and they find out, that's what's actually producing the symptoms. You get the right kind of correction, the treatment, and they start doing suddenly so much better. But wouldn't it have been nicer and better and easier if we maybe could have found that out 20 years ago? That's what they're trying to look at in this particular study here. And this, unfortunately, again, I'm jumping the gun a little bit, but they said, unfortunately, no. We're not seeing that there is a substantial difference in that initial 6-month phase between people with whiplash and people who are, again, quote, the healthy controls. Now, nevertheless, what they did find is that cases of whiplash, they were more likely to report non-painful neurological symptoms. So again, more going on than just pain, which include dizziness, nausea, sense of sickness, confusion, hypersensitivity to sound and light, visual disturbances, balance problems, cognitive challenges, again, that paresthesia tingling down into the fingers. And they really did. They did a good job here of looking at a number of different things. And I will point out that what they're doing is they're looking at things that are called p-values. P-values has to do with significance basically beyond reasonable doubt, saying that there's basically a 95% burden of proof, or that is any number that you see that is under 0.05 is deemed to be significant. So what they did find is that basically if you're looking at range of motion between people who are normal and whiplash, very, very significant differences. These are very, very low p-values. And so, yeah. You can look at a person's range of motion as a very clear marker. Something is not right. But when you start looking then at the ligamentous structure, at some of the other soft tissue structures, which can include brainstem herniations, the angulation of the cervical spine, vertebral offsets, degeneration, so osteoarthritis, these soft tissue changes that we were talking about, disc heights, wear and tear through the back parts of the vertebra, the front parts of the vertebra, they're basically finding that, okay, none of these by themselves is useful to be able to tell the difference between people who have had a 6-month whiplash injury versus those who haven't. Now, I would like to make the point then, and here it is right there. There were no statistically significant differences in any of the variables examined between the cases and controls. Now, I should probably raise the point here, at least in my own observation and experience, is that 6 months may not actually be long enough to develop these kinds of problems. Yes, depending on the person's sensitivity of their nerve system, they can still be experiencing these pains and other issues. But at least at this point, even though they're really struggling neurologically, it may be that it's going to take longer for a good chunk of these processes to actually develop. This is hypothetical, but it may also include cerebrospinal fluid flow. It may be that the body is able to adapt and find other ways to try to compensate for these things as well as it can. And then CSF is one of the challenges that's addressed down the track. And so when you see the change in the CSF through whatever treatment, again, a person is having, it may be that not just did whatever the treatment was resolve the CSF directly, but it may be what it did was it actually resolved whatever was producing the compensation that produced the CSF issue in the first place. In other words, there could be more than one layer of thing going on, and that by addressing the root cause, it is able to resolve all of them. But unfortunately, it means that CSF may not be the very first thing that evolves. It may be something that actually evolves down the track, secondary to these different kinds of things. In addition to that, it is also very possible here that, some of these people, again, who did have some of those, quote, non-severe injuries, that they did actually have a few things going on in advance. And these were perhaps risk factors. And maybe it's just going to take a little bit longer before these people then go on to start to develop some interesting problems in and of themselves. But one way or another, and again, this is correct in here, is that there is no statistical difference. You can't use CSF flow as a biomarker in and of itself to tell the difference between people with whiplash or people without. Excuse me. But there's one other thing that I should like to say there, and this is important from the clinical standpoint, is just because then you may be experiencing all of these different kinds of symptoms, even if your tests say that your CSF flow appears to be normal, you can still have these issues. In other words, you still need to do further investigation to then find out what the underlying cause is. Just because you might be able to rule out, okay, yep, you don't have altered CSF flow, there's still more work that needs to be done in order to find out what that root and that underlying cause is. So this was them as they were looking at fluid dynamics in the upper part of the cord and also in the lower part of the cord. So good on them. They were looking at a broad range, not just in one area to see if there was going to be any kind of statistical difference. So again, these are some of their conclusions. Our study did not reveal a higher prevalence of tonsillar ectopia, so that Chiari malformation or that balloon in the string pulling it down, in chronic whiplash cases in contrast to previously reported. Interestingly, the study by Friedman reported an even higher prevalence of tonsillar ectopia when examined during upright MRI in comparison to supine examination. These findings are relevant for future research studies of whiplash-injured patients where there is access to an upright MRI facility. Overall, our findings support the current opinion that morphological MRI in the cervical spine of chronic whiplash patients chronically contributes minimally to the understanding and the clinical course of chronic whiplash injury. Okay, let me go back to that one a little bit. One of the big things that was present also in Friedman's study is they were doing MRIs not just lying down the standard way, but they were done upright. And what they were finding is that when you do upright MRIs, you see 2 to 4 times as many of these pathological issues as you do in the lying down position. So again, is it possible that something may show up differently in an upright versus a lying down position? And they're making the comment here, okay, yeah, that is certainly a possibility, which may explain why when you look at different research studies, you are finding different kinds of conclusions here. Now, especially in Australia here, good luck with that, because if I'm not mistaken, there are 2, maybe 3 upright MRIs. I think that they have a very long wait list, and as useful as they can be, if I'm being honest, they don't usually change the form of treatment that you need. They are useful for diagnosis. They're useful in telling you, yes, there's a problem, we can see it, but it doesn't change terribly often in terms of, what is the care that is available to you. So if that is the case, that's where it's useful instead then to look at, well, what are the studies that are showing, whether you do or you don't, what are the ones that are useful for people who are experiencing these kinds of things? And this brings it back around to, well, what's the importance then of CSF flow from people who have had whiplash and are then going to see a chiropractor? It's in brief because there are research papers out there led by a gentleman named Dr. Scott Rosa, who's doing very precise corrections with the alignment of the upper part of the neck. And he's showing that in and of itself is oftentimes able to then restore normal CSF flow, and also a host of other neurological symptoms that otherwise these people are not finding good, healthy resolutions for. And so, of course, this is my particular, area of focus as well, which is why we talk about it in this video, is the understanding that, okay, yes, the neck does have an influence on CSF flow. But in and of itself, there can also still be other things going on that can be causing and contributing these different kinds of issues. And so just because, again, you might say, okay, yes, I've had this test, but everything seemed to be quote unquote normal. It still does not mean necessarily that means that everything is normal and that you should completely dismiss that area. It's because when you start to look at things from a more detailed perspective, you find other reasons for why people can be experiencing these different kinds of issues. So although they utilized the certain kind of MRI protocol to motion the CSF, it didn't reveal any potential clinical relevance of motion in the cohort with the thing. In other words, you can't tell the difference. We are aware that measurements at different locations may provide other results. So we repeat, when they said that they measured CSF flow at the upper cervical, the C2 vertebra, they didn't do it at the C1 or at the opening of the foramen magnum, the base of the brain, which is where so much of that cerebrospinal fluid actually emits from the cranial bolt in the first place. In other words, they're saying there could be a difference if we were to actually be looking at other areas relative to these whiplash injuries. They also say in context of frequently recorded painful, non-painful neurological symptoms, clinical findings often observed among chronic whiplash patients, central nervous system, including the brain, brainstem, cerebellum, and nerve roots require further investigation. So here they go right then and there. They said we used pain as a biomarker as one of the ways of defining normal versus not normal. But there can be more things going on than just that. We were looking at the cord, but you can also have brain. So if we're talking about the cerebrum, it's going to be involved with cognition, brain stem, vital life function, cerebellum, balance coordination, and the nerve roots themselves. As the nerves exit each of the openings through the spinal cord, if there are local eddies or currents or disruptions right there, it can actually affect the nerve flow then going all the way down to the hands. In other words, they're saying, unfortunately, as much as we would like to use CSF flow in the neck, there are still, and it seems to be that there are other things going on. So as much as we'd like to say, if you have a whiplash injury and you're in chronic pain, have a CSF flow study. If you have a CSF flow problem, yep, this is what you do. Unfortunately, it's not quite that linear. But that's ultimately the point, is that as much as we would like it to be linear, it's not the way that the body ultimately works. And so it still requires then that we do that deeper dive, deeper investigation, that just because things might appear to be quote unquote normal does not mean that everything is still working the exact way that it should be. And we just have to look a little bit harder. So I hope that you've enjoyed this particular little paper here. Again, in some ways, you'd say, well, that's kind of depressing, Jeff. There's no smoking gun again. But nevertheless, there's a lot of really important principles in there that I hope that, if you've listened all the way to the end on me, good on you. Hey, that's a good thing. Most people have fallen asleep by now. But that it gives you a better appreciation in terms of what and why you might be experiencing what you are, and as I said, what you need to do. So, pretty always, thank you guys for your time and attention on this. Again, if you found this one was valuable here, 3 things on the ask, the number one, is please do click that like and subscribe so that the internet algorithms will be able to get this information out to other people who might need to find it, might need to know these kinds of things. Number two is if you know somebody who is dealing up with one of these, whether it is yourself, friend, family member, please do share this video with them. It'll just be the standard link. You just share it to them, piece of cake. And then number three is if you are in the, well, really it's the Australia area, but certainly if you're in the Southeast Queensland area, and if you are dealing with one of these different kinds of issues, by yourself, and you've gone to this person and that person's still looking for answers, I'm not going to guarantee that I've got it all for you, but nevertheless, I can offer you a different perspective. And if there is anything that I'd be able to do myself, happy to help out. And for more information on that, all you would have to do is go over to our website, which is atlashealth.com.au. We've got links to videos like this and then some. The better part of, I think we're up to 200, maybe 250 different articles on a variety of different musculoskeletal and neurological conditions, all related to the health, alignment, and motion of the upper part of the neck, and any number of additional other resources that ultimately help people to find the answers they're looking for so that they can live the best quality of life that they are able to. So, thank you guys again very much for watching this video. So until next time, take care. Bye-bye.